Okay, those with history of malignancy who had underwent a conventional methodology of treatment, and they come for a recurrence or metastasis. To avoid a metastasis or a recurrence, that is the second group of patients. Now the third type of patient. Those coming with active lesions, but homeopathy as a first line of treatment. But it is a rare chance. Earlier it was a rare chance, but since our center is in move now, many cases are coming for first line treatment also. So that is the third group. And the fourth group is those coming for post effects of conventional methodology treatment, especially alopecia, skin and nail changes like fibrosis, discoloration, CRF or rather cancer related fatigue. And we can summarize that heading as for a rebuild of the system or rejuvenation of the system or optimizing the physiological normalcy. That is the fourth group. And the fifth group, usually they are destined to palliative centers from almost all conventional oncological centers. Many cases are being destined to suffer, and that is the last group for palliative. So these are the 5 group of cases which a homeopathy or rather a homeopathic cancer center can expect. So what are the targeted populations where homeopathy can be used as a first line of treatment? Let us summarize, because many times people or my fellow doctors usually refer cases to me asking that Dr. Vinu, what is the possibility of homeopathy in this case? What is the possibility in that case, or what we can do in this critical stage? Many questions usually come in my phone call as either WhatsApp message or direct call. So for that, to make it easy, for an easy comprehension, let me summarize or let me enumerate things like: first, the homeopathy can be used as a first line as metastatic cancer with multiple sites, because either the primary being breast, prostate, or stomach, wherever it may be. If it is a metastatic cancer with a wide mets, means either brain or bone mets or multiple vital center mets, homeopathy can offer as a first line of treatment. Second is primary lung malignancies, especially stage 4 lung malignancies. Because as you know, stage 4 lung malignancies carry almost a curved survival rate, rather a curtailed survival rate for below 6 months, 4 to 6 months. As you know, stage 4 lung cancer will be disseminated into the contralateral lung, into the mediastinal lymph nodes, or hilar malignancies, or a subcarinal space, multiple lymph nodes, and various other sites, especially adrenals, bone, or brain, wherever, whatever it may be. So in stage 4 lung cancer, a surgeon's knife is having a limited option, like a pneumectomy or lobectomy is not possible. Chemotherapy is not possible since patient may be having other comorbidities, and radiation is out of the thought because it is a widespread thing, and we can select radiation in metastatic stage 4 lung cancer only to a metastatic foci. For example, if the patient is having vertebral mets or bone mets which is making him unbearable pain, then a palliative radiation can be given. So primary lung malignancy, especially stage 4 lung malignancy, is a good area of homeopathy. Third is hepatobiliary and pancreatic malignancy. I think it is one of the best area to be explored more by the upcoming homeopathic generation. That since liver is the primary active gland in our body, and almost all therapeutic drugs may act as an imminent problem to the liver, homeopathy can offer a good area in hepatobiliary, rather in pancreatic malignancy. As you know, pancreatic malignancy carry the deadliest prognosis below 4 months. And we are having cases with extended survival rate for almost 48 months. That means for 4 to 5 years, we could extrapolate with homeopathy. And cases with the other post-surgical or loss of physiological equilibrium and electrolyte imbalances. Usually in malignancy, we could see that cases may be coming with a repeated problem in physiological optimization. For example, they may be having severe pallor or a severe hyponatremia, hypophosphatemia, or rather hypocalcemia. and almost every week they may be supplementing this calcium, sodium, or whatever be the depreciated mineral or element, but still the patient vitality may be very less to compensate or rather to accomplish the physiological equilibrium. Then homeopathic medicines administered in genuine potencies may equate the physiological optimization. Fifth is primary prostate malignancy. As you know, prostate is encapsulated in a capsule. Prostate malignancy is usually slow spread in nature. We can offer a good treatment thing in prostate cancer. Sixth thing is pancytopenia that we had discussed earlier. Because after inevitable chemotherapy or radiotherapy, when I say inevitable chemotherapy means usually patients may be in primary stage of active lesion and they may be regularly referred to a cancer center where they receive a chemotherapy, either definitive chemotherapy or a palliative chemotherapy. Pancytopenia, maybe because of a granulocyte reduction, will be the essential complication for which they offer a period of rest with the nutrients, with the fruits, with adequate protein or multivitamins. But still, if for example, if the tongue is devoid of papillae, then the medical oncologist may say that you have to undergo another course of antibiotics, multivitamins, then only your body will be fit for the next scheduled chemotherapy. There, homeopathy can offer a good help. There, that is, the count could be addressed beautifully. Again, for pain addressing, where excessive use of morphine may result in residual effect. Because usually in malignancy, patient may be in continuous use of tramadol, ultracet, or in an escalating mode, lastly in morphine. So we could reduce the usage of morphine, since morphine may cause morphinism. That's why I put in semi brackets calcarate carb 30, which is a specific remedy for controlling pain. For whatever malignancy, if the patient is on morphine and if we are not getting any result with the indicated medicines, try calcarate carb 30. This is a gift which I got from Dr. Ismail said. I humbly bow my head for this valuable tip given to me by him early a decade back, which I am regularly using. Thank you, sir. So where are the targeted populations where homeopathy can be used as an adjuvant treatment? Because many times homeopathy is termed as a CAM therapy. In Kerala, we use it as an alternative medicine. But in Europe, in general, and other areas in particular, homeopathy is coming with a CAM group. CAM means complementary and alternative medicine. That meaning is it can be used as adjuvant treatment along with the conventional medication. So where it could be used as an adjuvant, along with or post-surgical cases. Example, oral malignancy. Usually here, the doctors should make a special note that kindly don't take primary head and neck cancers with homeopathy, because that may cause serious problem, including legal issues also. Because oral malignancies are having definitive international protocols by conventional methodology. So we don't take primary tongue cancer or see a cheek like that exclusively with first line of homeopathy. We used to wait what conventional medicine can offer to them, because whenever head and neck cancers get aggravated, it will be a devastating thing for the patient. And usually alternative system of medicine is incriminated by the medical profession that we are losing the buffer time for that patient to get it cured by a simple surgical excision or a simple radiation, and alternative systems are wasting their time. So we don't waste that buffer period. So usually as a government center, we used to wait. So after wide excision or after a local excision of primary lesion in tongue or cheek, if the patient likes to avoid chemo or radiation, we can take homeopathy as an adjuvant therapy there. Again, primary breast cancer. In breast cancer also there is international definitive curative protocols. So we can't say take a primary breast cancer, especially in a lady of reproductive age. For that, we used to specify or we used to deduce a group of breast cancer known as TNBC for triple negative breast cancer, where HER2, ER, PR, other hormone receptors are negative. Otherwise, primary breast cancers, may go for an excision, maybe a local excision or an MRM with axillary clearance. There, if the patient wish to have homeopathy instead of conventional methodology, we can give a sufficient treatment in the expecting that we could avoid mets or we could avoid the extended survival rate. Again, this means gastrointestinal stromal tumors after excision, homeopathy can use as an adjuvant therapy. What all tables I am putting here is coming out of my pure experience. This center has started its function by 2008. Now it's the 13th year we are continually pursuing on the same thing. So what all things I am putting in my laptop is coming out of pure experience only, not at all any fabricated data. So primary prostate malignancy after TERP, if the patient is coming after TERP, definitely homeopathy can offer a treatment instead of abiraterone or a bilateral orchidectomy or a continuous infusion of zoledronic acid to maintain the bone, or we could avoid chemotherapy drugs. In bladder cancer also, for avoiding recurrence after TERP, transurethral resection of bladder, we can give homeopathy as adjuvant. Again, genitourinary malignancies like CIUS, cervix, with the BSO plus omental clearance means bilateral self-injuratory with bilateral omental clearance, we could offer homeopathy as a treatment. Again, with the chemoradiation, along with chemoradiation, those are post-surgical. Now, with chemoradiation, where homeopathy can give as an adjuvant therapy. First is retinoblastoma, one of the deadliest tumor coming in eye, which may lose vision. Again, melanoma, hematological malignancies. Always take a note for these listeners that never take a hematological malignancy in a primary stage, because that may invoke serious legal issues, as there is definitely international protocol for leukemia and lymphoma, and especially if the patient is in a minor age. If it is an adult age, we could take, and we can take CML. Chronic lymphatic leukemia we can take directly, but acute lymphatic leukemia, acute myeloid leukemia, definitely the patient has to go in a medical oncologist. Then after their opinion, we could treat, we could make the plan of treatment. Again, lymphomas, sarcomas, multiple myeloma or plasmacytoma, we could give homeopathy as an adjuvant therapy. So searching in Organon where we could find a plan of treatment, it is one-sided disease. So I'm not going into the detailed part of Organon. So malignancies, Master Hahnemann has given in his dictum in one-sided disease, especially 172 to 184. Mainly malignancies are chronic disease, for images are not clear. Here partial minimum is a choice. 2 or more prescriptions in the right direction to get more clear images and then prescribe accordingly. 2 or more. Sorry. 2 or more prescriptions in the right direction to get more. Hello.
Okay.
2 or more prescriptions in the right direction to get a more clear image and then prescribe accordingly. Here, cure is not possible in every cases. Palliation in extensive advanced case we can offer. Law of palliation is again same as law of cure. The last line, which is the gem of the line, the patient is brought to a more better state of health than the previous, even though not cured. That is a great point to be noted, because many homeopaths think that always cure is our aim. No. In which state of health the patient is residing, the genuine duty of a homeopath is to make him escalate into a more better state of health than the previous. This is an observation coming from Professor George Vitulka's Science of Homeopathy. So coming to the crux of our talk, what are the challenges? These are the preliminary ideas which I offered. Now, exactly what are all the challenges for a homeopath in treating a pure case of malignancy? First is intervening infections. I think this is the difficult and most deadly barrier for a homeopath, because for an allopath or rather an attending nurse, it is very easy. They could give acetaminophen with antibiotics. broad spectrum antibiotics are there. No need to ask. 3 days, 5 days. If it is not working, then fluconazole, higher doses, multi lines, no problem. But for an homeopath to continuously pursuing a malignancy case, if an intervening infection occurs, it's the biggest challenge that we will deal in detail. Next is fluid overload. Usually we know patient with ascites, patient with the pedal edema, patient with the scrotal edema, patient with the increased JVP giving rise to cardiac respiratory problem and thereby leading to poor performance because of the excessive fluid accumulation in pleura and other body cavities. And there also an allopathy is very easy. They could prescribe those Lasix, those drugs are there. They could prescribe and the fluid will go. But for a homeopath, it is very difficult. We have to find a specific there. Next, the third challenge is fever. You may feel surprised that how fever is a challenge. It's a biggest challenge. I think malignancy fever is a great challenge, especially in hematological malignancies where fever may go around 104 or 105 for consecutively for 3 or 4 days, where the physician sweats more than the patient to find a remedy. Many times it's an extremely challenging thing for a homeopathic cancer management. For this dyspepsia, even though dyspepsia is a group of symptoms, that means generally flatulence. There again, they are very gifted. They are having Emiset, pantoprazole, omeprazole, injection Pandop 40. Very simple, they will give an injection, the patient will be get rid of the whole flatulence and the turmoil. But for a homeopath, prescribing a remedy again, and those who disturbing, it should not disturb the previously cited remedy. It's a challenge. The next challenge is metastasis, which is a great big topic, which is beyond a discussion. It needs an entire elaborate description regarding metastatic cancer. Next challenge is tumor reduction, or rather primary cytoreduction, whether it is possible or not with homeopathic medicine. Many times I have been in touch connection with many of the medical oncologists all over Kerala and across, apart from our country also, medical oncologists, stalwarts like Professor Narayanan Gutti Warrior from MBR Cancer Center, Prashant Parameshwaran, Arun Warrior, Dr. Satish Balasubramanian from MBR Cancer Center, Dr. Manjula from Regional Cancer Center, and many of the stalwarts I am on discussing problems. So many times they ask me directly. Also from American Institute of Oncology, which is a newer institute in Kozhikode, AOI, American Oncology Institute, where Dr. Danya, a radiologist, who is very passionate about homeopathic medicines, because we used to treat cases together nowadays. She will give palliative radiation for me, and after that, I will give medicines, and together we try to improve the quality of life, thereby adding more flying colors for the patient. So tumor reduction, all of us ask me a direct question, whether Dr. Vinu, is it possible for homeopathy to make a cytoreduction? And many times I will say, yes, ma'am, it's possible. It's possible, but on some selective conditions. Again, another challenge is lymph node regression. It also needs to be rigorous, because as you know, TNM staging, N stands for lymph node. For a malignancy, N 4, 3, 2, 1. Is it possible? Yes, it's possible in homeopathy. Again, electrolyte imbalances, as I told you, hypophosphatemia, hypocalcemia, hyponatremia, hypokalemia may all cause medical emergencies. So that has to be addressed genuinely and addressed permanently. Another challenge is anemia, which is a simple thing, pallor, but again, it needs blood transfusion with either blood products and homeopathic medicine. So the challenges, again, active lesions is a challenge. Post-treated lesions, maybe post-surgical, post-chemotherapy, post-radiation. Recurrence is a biggest challenge for a homeopath. If a lesion is getting recurred, every day I receive almost more than 10 case details in my WhatsApp. Today also, I received in the morning first case, and a young man, a young lady with a surgical recurrence of glioma. Surgery, craniotomy done just 8 months back. Now the glioma is back again. What to do? No irradiation possible, no resurgery possible. Whether homeopathy can offer something. This was the first case today. So this is the biggest challenge. Third challenge is absence of tumor markers. Tumor markers get activated after conventional medicine get a rest period. especially CEA, CA125, AFP, PSA, just like that. Fourth challenge is relapses in hematological malignancies. Hematological malignancy, as you know, acute lymphatic leukemia, acute myeloid leukemia, M2, M3, M4, M5, whatever it may be, I told you, we don't take cases in the primary first line of treatment. We wait for the conventional medicine. After that, we are getting more cases with short relapse. Always remember, a short relapse after scheduled chemotherapy is not at all an indication for re-chemotherapy. So they will wait and they will say the patient that the prognosis is bad. So usually we receive cases like that. Earlier our results were grim. Now our results are getting more clear. Fifth challenge is metastatic cancer, which offer a fluid overload, continuous fever, continuous flatulency, or acute frequency of disease. Acute frequency of disease means whatever itis, pneumonitis, urethritis, cystitis. Every itis is a big challenge while treating with homeopathic medicine. Again, challenge is continuing. Immunocompromised status. How immunity shall be compromised? As you know, chemotherapy or radiation may give patient a compromised immunity. Again, residual effect of treatment. What all residual effect? We get fibrosis, scar formation. Those residual effect again a challenge. Control of intervening infection that I showed you in the first slide itself. Intervening infection is a challenge. And the last is widespread metastasis. So now going specifically, what are the post-surgical challenges? Last slide we saw challenges in general, but now we would like to enumerate what are the post-surgical challenges in malignancy. First is a scar formation, which is a simple thing for a surgeon, but a difficult thing for the patient and also for the homeopath. Usually patients come to homeopath showing this wound scars. Something could be done because I can't open my mouth because surgeon is satisfied. He had made a good incision, he had made a good excision, but the patient is having eventually fibrosis. So the patient is unable to have a good mouth opening. So scar formation, fibrosis, keloid formation, and last is loco-regional recurrence, means the very local recurrence at a surgical site. These are the 4 surgical complications which we could give more better results with homeopathy. So coming specifically to the chemotherapy challenges, what are all the chemotherapy challenges? Usually I would like to give my listeners a motto that never blame chemotherapy or radiotherapy as bad when we receive a patient in malignancy. Actually, I don't do. I always welcome, or rather, I always respect all methodology of treatment. You all should respect treatment modalities because chemotherapy, as you know, it's a boon in many cases. It may be problematic in some cases, and it is devastating in many cases also. But in most of the cancer cases, what all therapeutic beneficiality chemotherapy can offer is you should appreciate. So whenever a patient is coming after chemotherapy or during chemotherapy, we usually don't say that it's because of this. We usually give a patient listening to him or to her, hearing her complaint. Usually those complaints can be listed as pancytopenia, which we discussed earlier, maybe getting as a total reduction of granulocytes, plastic anemia, and mucositis, which is a difficult thing for the patient to have his daily bread and drink. The third chemotherapy challenge is skin and nail changes, the alopecia, hair loss, decompensated physiological status. This decompensated physiological status gives rise to a total loss of appetite, which is a difficult thing for the patient and for the bystander. Many times we receive patients not for treating their cancer. They are asking, sir, my mother, my father can't take even a bolus of food. Please help us. When we ask the patient says, I am having no taste, no appetite. How can I take food? So there homeopathy can address food, sleep deprivation, nausea, vomiting, hiccough. Hiccough is a great thing which homeopathy can manage. So coming to the next chemotherapy challenge, emotional struggles, anxiety, dementia, mood changes. many of the medical oncologists are unable, or rather, they won't even ask what is the emotional mood. But homeopaths are more interested in emotional mood, so we could address them very beautifully. Anxiety, dementia, mood failures. Failure of optimization of fluid and electrolyte is another chemotherapy challenge where continuous loss of blood may cause anemia, hyponatremia, hyponatremia is a medical emergency, hypokalemia or hyperkalemia, calcium level depreciation or calcium level alteration. These are the chemotherapy challenges. So coming to radiotherapy challenges, what are the radiotherapy challenges? Necrosis of skin, mucositis, dermatitis, eczema, scar formation, atrophy of glands. This atrophy should be validated very clearly because salivary glands for a scheduled and prescribed dose of radiation in salivary gland cancers or in mouth cancers, the salivary gland get atrophied and the patient may have a dry mouth, just like Nux mostata. The patient may carry a bottle of water every time, licking because total glandular atrophy. This can cause as a dry eye also, lacrimal, and if it affects Bartholini's gland of a female who has underwent the chemo radiotherapy for CA cervix, her sexual life will be a great difficulty because it will be a dry vagina. So with that should also be addressed, and homeopathy medicine could address these things very beautifully and nicely. Discoloration of skin and nails, alopecia from head and beard. So these were the challenges. So we enumerated the challenges. Now coming to the methodology, what methodology we could adopt as a definitive protocol. Methodology we can generally, usually I know you all are great homeopaths, you are having your own protocols, but in malignancy, if you could follow this type of things, it will be more easy. That is my word. So in cases where chemoradiation has underwent and a patient is coming after chemoradiation, our idea is to make a hooking method for him. Because we don't prescribe a constitutional medicine for him at that moment, because many times the patient may be unable or the patient may be physiologically much low in a threshold level to take medicines at that time. So I coined the word as hooking method, which is the same idea by Roger Morrison of USA as fixed fact methodology of prescription. Roger Morrison in his collected seminars say that many times in one-sided disease we have to go for 6 fact prescriptions, 1, 2, 3 like that. After that the patient may into a correct sequence, synchronized thing, then we could select the medicine appropriately. So the same idea we are terming as hooking method. So usually the medicines indicated after chemotherapy is acetic acid, CKL cognatum, X-ray, cadmium sulfuricum, acid muriaticum, and rhodium bromide. Acetic acid, as you know, is a special medicine for malignancy. CKL cognatum for post-chemotherapy, post-hot. The patient may be extremely hot with the devoid of papillae. She is unable to even swallow a single cup of water. Very cachetic. You just remember the individual description of CKL core, cachetic, weak individual who desire sour drinks. Usually they ask lime juice. That's a specific indication. Because or sour buttermilk. That is the keynote question I asked, whether you would like to have something sour. If yes, then I used to prescribe CKL or X-ray for blood reduction, cadmium salt for that black vomiting with again with the symptoms of arsenic and amalgam. But the differentiation point of cadmium salt, as you know, Master Ken has given in his lectures that while arsenic and cadmium salt share the same anxiety, same thing, the patient lie deadly still in the bed. I remember a case of CA pancreas with intestinal infiltration with the liver mets, a young man referred to me by a homeopath, and the patient reached hospital late evening, and in my night rounds, I was seeing the patient with absolutely no indication. But the thing is, the patient is passing stool for more than 20 times, continuously oozing. When I search for symptoms, it is just offensive like arsenicum, just watery, black. Arsenicum was prescribed, but no result was there. But then I after some time, I watched the patient from a distance, and I saw that the patient just rise from the bed, he goes to the closet, come back again, lies still, no talk, no problem, just lie still. After that, he gets the urge again, the same process. Then I remembered Master Ken from lectures which I have read early in my graduate studies. So cadmium sulfate was given, and it made a remarkable change. After that, phosphorus was indicated, and the patient fortunately extrapolated. We could extrapolate him for such a period of time with phosphorus, and eventually the patient died. As we know that those are incurable cases. But these are the instances which I could repeatedly assess those efficacy, those indications, because we are having a full-fledged IP center in our. We are fortunate to have an IP center exclusively dealing with cancer cases, and those cases are really, really bad, really great cases. So again, acid muriaticum with the patient coming with extreme weakness after conventional methodology. You remember the metamedical acid muriaticum, radium bromide again. These are the cooking methods. In post-surgical cases, we could assess Staphylococcus aureus as the main medicine, Aerophanes, post-surgical platters, strontium carbon. Strontium carbon, as you know, is a surgeon's carbovage. Bismuth, Bellis perennis, arnica. All remember Staphylococcus aureus, bismuth, and Aerophanes, but strontium carbon, Bellis, and arnica should be remembered. Among which strontium carbon and Bellis perennis, they are really giants. To get into the cracks, they will help. They are like just messenger RNA and going for the transcription process, taking pulse from the DNA to make a protein, new RNA. They are the messenger RNA. What they are doing is going to the tRNA, the mRNA vital role in cell mitosis is the same thing these cooking method medicines are doing. Acetic acid, calcarea fluorine, that for specifically for adhesions, calcarea fluor we can give. Veratrum album, strophanthus, again strophanthus is a boon. What digitalis could not do, what convallaria can't do, what is that medicine? Strategus can't do, strophanthus will do without any cumulative action. You should remember strophanthus, especially in post-surgical cases where bleeding is not stopping, strophanthus will stop, and those bleeding may give rise to imminent cardiac failure, and strophanthus could stop that. And we could see those changes from the cardiac monitors in our ICU. We are fortunate to have a good ICU there. So cardiac monitors are there. We could see the power of action of our medicines in a eagle eye. Thiocinaminum, again, laurocirrhosis. Great remedy. If you go with tetrabodica, I will take your whole day. Sorry. So in primary cancers with active lesions, what all medicines we can give? Deeper spheres, arsenicum album, arsenicum iodide, echarate carbonica, causticum, natrum muriaticum, medornum, calcarea fossis specifically for leukemia, mercuries for lymphomas, colorectal, acid nitricum, gastrointestinal, renal cell for lycopodium, pelvic malignancy, sepia, gut malignancy, Cilicia, Staphylococcus aureus, and Ruta. For verrucous cancers, Tuja. These are the deeper medicines. Causticum, natrum muriaticum, sepia, Tuja, Staphylococcus aureus. Again, superficial action, we will get aconitum, belladonna, echinacea, ignatia, calendula. Calendula, as you know, is an intercurrent also. Pulsatilla, opium, max force, acid force, uranium nitricum, carbonate, and these are superficial action getting medicines, which may get our patient into the right track, and after that we could prescribe with more confidence. So again, we could give other medicines to augment, to enhance, to accelerate our medicinal action. 3x in potencies we can give progesterone in CA liver, in cholangiocarcinoma, lecithin. Usually I prescribe lecithin for getting convalescence in the increase the count, pepsinum in gut malignancies, thiocinaminum for adhesion structures, rectal structures. Usually after radiation, patient present with the rectal structures where the stool is passed like a thin ribbon because of that stricture, and patient has to make great effort. Thiocinaminum will solve the issue. Uranium nitricum for Duodenal malignancy, the specific thing, urine and nitricum for duodenal malignancy, pancreatinum for pancreatic cancers where they have removed part of the pancreas, uforinum for post-ovarian tumors, antipyrinum for count reduction in chemotherapy. Again, coming the biggest thing, relapse or recurrence in malignancies. For relapsed case or recurrence, we have to go into a deeper medicines. Deeper medicines in homeopathy means basically nosodes, medorinum, melandrinum, carbonium sulfuricum, calendula specifically for blood-related malignancies. If blood-related malignancies are getting recurred, calendula should be given as intercurrent. Lycopodium, as you know, lycopodium has transcendented the whole process of evolution like equisetum. Lycopodium should be used in relapsed or recurrence cases, in leukemia, blood malignancy, phosphorus, in pelvic malignancy, sepia, Stillingia. Stillingia is a rare remedy. Many homeopaths may use it for alcoholic de-addiction along with cocaine. So thyroidinum, tuberculum, thyroidinum is a great medicine for recurrences, just like tuberculum. Calcarea carbonica for lymphomas, Calcarea fos for myelomas. For plasma cell myeloma or multiple myeloma, Calcarea fos along with causticum is my first line remedy. And 90% of the cases are getting more extended survival rate with Calcarea fos and causticum. Iodum, arsenicum iodide. Always remember when iodide get combined with arsenicum, the real action of arsenicum will exemplify. Syphilinum, silicia, Staphylococcus for gut malignancy, mercury, carcinosin. Interested people can make a note of these things. So what is the methodology we are using? Usually we use prescribe in LM potencies, that is in 50 millisecond potency, either in alternate days or daily days, depending upon the emergency. Because if the patient is having active lesion, we are unable to prescribe a centesimal medicine always. So a safest method is LM potencies. It can be actively and frequently repeated. If needed, there are situations where more than one medicine may needed. So LM may take hand the patient along with our acute medicine. There may be chances, rare occasions are there. So to start with one medicine, 15 medicine, then followed by the indicated medicine is our idea. Physiological doses, usage of mother tinctures we use and as and when indicated. Allowed to continue with existing prescription first and then focus to paper. Never we advise to or advocate to the patient to stop all the medicines on a sudden, no abrupt stopping, but tapering and then someone is getting sleepy, so they are making their skills in the screen. So categorize first where this case belongs, review every 2 weeks. Our review is on fortnight basis, monthly, assessment by imageology, biochemistry, immunohistochemistry, clinical serology, histopathological studies, and our focus period is 3 months. First focus baseline is 3 months, then 6 months, up to 2 years, our target is 5 years. Usually these are the tinctures we are using: Belladonna for pain, epics, chamomilla, chelidonium, cardus, clematis, chimaphila, ornithogalum, podophyllum, ruta, wine, helonias. These are the tinctures we are using. Acutes, these are, I told you. So metastatic cancer, as you know, these are the now coming. Hello, please. Someone is drawing this. Can it may be erased? The screen is getting disturbed. Experiences. So after challenges, hello, am I audible?
Yes.
After our challenges, we now are going to the experiences in oncology. So what is the experience we are getting with a homeopathic medicine in oncology? First is extended longevity or extrapolated shell life. That is the first and foremost motto a homeopath should offer to the medicine in general or oncology in particular, that homeopathy medicines could offer an extended longevity. Second is better quality of life. The quality of life is the great addressing by our systems, but I think homeopathy along with Ayurveda or yoga would give better quality of life than any other modality. Control of intervening infection is a possibility that we could experience. Earlier, it was a challenge. Now it's an experience. Metastatic reduction was a challenge. Now it's an experience. Please erase the screen, but someone has made the screen vanish. Sorry. Where the screen has gone, I don't know. Okay, is it okay?
Yeah.
Metastatic reduction, cytoreduction was a challenge. That is,
Sir,
tumor
can you share the screen again? Okay, fine. Good.
primary cytoreduction was a challenge earlier, but now cytoreduction is an experience. Lymph node regression was a challenge, but now it's possible, it's an experience. Physiological optimization, many times homeopathic institutions lack proper nursing care or IP facility. So, as Dr. Manoj told about my effort, I would like to say one sentence that when I started this cancer OPD as an OPD in 2008, way back 13 years back, I realized the correct need of an IP facility for a homeopath. But many times our cases may be losing just for giving blood transfusion or fluid transfusion. With that 5-year study, I made a proposal to the government, which I was fortunate enough to be put forward by our member of Legislative Assembly and the then Minister of Mr. Anil Kumar, and he took up the issue. And after that, a 10-bedded hospital was granted with all general nursing staff. So, if there is a good supportive care, homeopathy can offer more. That physiological optimization is an experience. Next slide is following. So, what is the aim in each case of oncology in homeopathy? This is a different topic, which I made a deliberation in CCRH Ministry of Ayush last year. And this is going to be in the print edition of CCRH Protocol of Cancer, which we could be proud enough to say that our idea is going to be printed as the CCRH protocol. So what are all the aim? Primary cancer, there may be 2 types for conventional methods attempted but unable to continue, or where cases coming as fresh. There we can use a constitutional or a pathological or a specific medicine. What is the aim? To reduce the primary, to control secondary infection, to increase survival rate, and to combat future meds. These are the aim in these type of primary cancer. To reduce the primary, to control secondary infection, to increase survival rate, and to combat future meds. In cases where conventional methods are unable to continue, there what is the aim? To regain homeostasis, that is the electrolyte imbalance, blood products. By giving supplementation, we could regain it to control intervening infections with immunocompromised. What is the aim in post-surgical cases? There we can use a constitutional medicine. If a case of malignancy is coming after surgery, select a constitutional medicine to avoid recurrence, to control tumor markers, to avoid meds. If it's a case of, for instance, it's a case of ovary, after surgical removal, there may be an upsurge of tumor markers, which could be addressed with a constitutional medicine. And to avoid meds is the aim there. In post-chemo radiation cases, again, constitutional or pathological medicine similarly can be tried to control tumor markers and to reduce the tumor load. In palliative case, what is the aim? To deal with all aspects. So there, multiple medicines can be used, including injections. In palliative cases, where we use multiple medicines. Metastatic cancer, where they can be used constitutional or organ-specific or pathological medicine. Because our aim is to control the metastatic foci, to control intervening infection, to deal with system failure. The third point is very, very important. Because metastatic cancer usually present with system failure, either maybe a respiratory failure, cardiac failure, neurological failure, or renal failure. So we have to address those comorbidities also. And the fourth is to increase survival rate. The last is to improve quality of life in metastatic cancer. Again, in cases undergoing chemoradiation, if a patient is coming to you saying that I am taking my prescribed chemo or radiation, I want homeopathy, then usually our dictum is avoid medication. Ask to report after the procedure, because many times oncologists ask if an emergency occur in a patient, they ask that whether you took any other medicine. And if the patient says that I took homeopathy medicine, they will ask, oh, so that drug may be interacted. Drug interaction may be there. I remember an instance where I treated a child with osteosarcoma, having lung meds, and the patient was having little bit changes, and the child went to a review for the oncology department, pediatric oncology in RCC. There they felt some change and they asked, what medicine you are using extra? They told that, of course, homeopathy. Immediately, she took my number and she rang me from RCC directly to me, asked what medicine you are giving. I told, ma'am, this medicine. So your medicine is making any drug interaction? I told, no, ma'am. Our drugs are safe. How? What publication? What proof you are having that your drug is not interacting with our medicine? As we all know, we lack publication or we lack things. So these are the questions usually raised by the medical profession. So if a patient is undergoing chemoradiation, you just wait till the procedure is over, and after that you can give medicine. For example, for count reduction, electrolyte imbalance, those things you can address. So this is a case of CA gallbladder with a hepatic mets. It's a post-surgical case. So just sample case. They removed the thing and the patient reported to us. What we could achieve in that case, the patient was a 71-year-old lady. Her liver size reduced. So in the last scan, hepatic mets is in question mark. Liver mets got reduced. Better quality of life. Survival rate prolonged for 2 years without essential complications. No intervening infection. So these are the points you should tagline with whenever you say that homeopathy could extend survival rate. We should add them, especially with no complication and no intervening infection. Then only that carries value. Otherwise, after yoga or after Ayurvedic medicine, my grandfather survived for another 10 years. So that is possible. But you should say that extended or extrapolated survival rate we got, especially with no complications and no intervening infections in between. So that's a sample case. Again, a case of CA cervix where homeopathy was only tried. We gave Helonia stinger there along with the medicines. Patient stable, no intervening infection, no meds. The MRI recently diagnosed invasive cervical cancer. Again, CA colon post-surgical cases. CA colon, we are having a good chance after you ask the patient to get the colon removed, like hemicolectomy. After that, we could give medicines. It will prevent mets and it will extend the quality of life. See, this is a case of operated case of CA colon post-operative. You see the last impression. No liver mets, no bone mets, no ascites, no lymph node enlargement. So that is possible with homeopathy. It's possible. Again, a case of CA bladder where we prescribed Tuja Varnam as the first medicine, then Staphylococcus aureus, LM third with Taraxacum tincture. It made you see urinary bladder appear normal with normal wall thickness, lumen clear, bilateral kidneys and prostate appears normal. So it's possible. We can collect as much as of cases like this. I'm just taking 1 or 2 cases. Again, metastatic cancer with the liver adrenal secondaries. Kali carbonicum was the medicine prescribed in 3rd, 6th supplement Solidago tincture. The last, the patient survived with removal of the chest wall mets, bony beds, and the patient survived for 4 years. That was a 76-year-old patient with metastatic cancer surviving for 4 years with almost all mets all over the vital organs. Only homeopathy can offer. Again, CA prostate patient survived for 6 years. Govindan Nair, 79. No evidence of any abnormal bony activity in the region of the features are not suggestive of skeletal secondaries. You see, in a case of CA prostate, there may be skeletal mets eventually, and for 6 years, no skeletal mets. Still, the patient is alive. So, what are the criteria for IP admission we are getting here? IP admission in homeopathy. Many times doctors ask, what is the domain of homeopathy in an IP setup? First is nutritional deficiencies we could address. Blood and blood products for compensating myelosuppression. I could say with confidence that in our center, on a daily basis, we are giving blood products and blood transfusion, both packed red blood cells, plasma, platelet, and whole blood also. We are having tie-up with Perindalmanna Taluk Hospital, blood bank. They are giving blood as our desire proposal goes, and it's absolutely free also for our center. So earlier we were unable to give blood compensation, so now on a regular basis we could give blood product, and along with our medicines it make remarkable changes for the patient. Again, for procedures we would admit the patient for catheterization, enema, suction, nebulization, artery insertion. All these procedures are being done in our center on a regular basis. Skin and wound debridement, control of intervening infections. We are having grading of patients as red, yellow, and blue. And with that, we admit patient for a period of 3 days, 5 days, 7 days, 14 days, or 21 days on a regular basis, on a basis of their need. So coming to the outcome, so challenges over experience over what are the outcome conclusion, or rather what can be concluded. A paradigm shift in management in oncological cases. It made a paradigm shift. Paradigm shift means it made a 90-degree change in the approach of oncology management with homeopathic medicine. We could be successful. We are successful, or we are able to detect protocols, definitive protocols for oncology in general, and on many oncological cases in particular, like breast cancer guidelines are there, just lung cancer guidelines are there, hematological guidelines are, pediatric oncology we are trying to evolve. Now we are having a MD doctor for pediatric department. Now we have made a division of medical oncology, gynec oncology, pediatric oncology, palliative oncology, home care, and the last is the rehabilitatory oncology, which encompasses psychology, physiotherapy, yoga. So 6 departments, we work as 6 departments: medical oncology, pediatric oncology, gynec oncology, rehabilitation oncology, palliative oncology, and home care department. So we were able to detect protocols, again, focusing the area of intervention, where we have to address, where we have to look to focus the area of intervention is an outcome. Development of strategies that I will enumerate in the next slide. Strategies have been developed. We could plan each case the same way like MTDB, multidisciplinary tumor bodies, discussing cases. Now we are fortunate to have 6 doctors, a panel of 6 doctors are here. So we will plan accordingly for each case, and the last outcome is we are in the process of publication. So let me elaborate some points on strategies of management. Homeopathy could use as a complementary medication in oncology. First strategy as a complementary, because we are capable of regaining the physiological equilibrium for the patient. Again, as a first line of treatment or alternative style of treatment, we can use homeopathy in oncology. Third, as a supportive therapy or adjuvant therapy, we can use. As a palliative therapy, we can use homeopathy. And the last, but not the least, as a preventive therapy or a prophylactic therapy, we could use homeopathy. So these are the possible strategies. Again, let me summarize. A case of CA colon, a male patient aged 77 with T3N2 M0 ascending colon and lymphadenopathy. His histopathology revealed adenocarcinoma. The patient gives bilateral edema, pain in the treatment of food appetite. Treatment history, he came to us after hemicolectomy, no chemotherapy, and we put on our medicines since 2020. Our medicine was sulfur followed by lycopodium in LM potency. The CT scan revealed on November 2020, CRI post-cytolectomy, no lymphadenopathy, no thickening, only grade 1 prostate. Every time you should search for lymph node. When you search in ultrasound or a CECT, contrast enhanced computer tomography in abdomen, you should search for any unwarranted lymphadenopathy, just like para-aortic or pre-aortic lymphadenopathy, any thickening, any lesion, any free fluid. No, nothing. So this is possible with homeopathy. Homeopathy can prevent metastasis of CA colon. It can improve quality of life. Again, a sample case of non-Hodgkin's lymphoma, male patient, age 60, came in splenomegaly. See the size of the spleen, 13.5, abdominal lymph node enlargement, grade 1 prostate, grade 1 fatty liver. No treatment. He came directly to homeopathy treatment. So we put him under medicines from since 2019 Jan. Podium Mac 200, Calcarega, Lycopodium, followed by sulfur, Tuja, Madonna, Sundrakan, Singers, Spongias, Croflarias, Unacus, as and when needed. Overall, this period, investigations done. See, you can see the investigations. USG neck, there is lymph nodes, CT thorax 2018, enlarged axillary mediastinal retroperitoneal lymph nodes. Last USD, you could see fatty liver grade 1, moderate prostatomegaly, normal sonological study. No thickening, no fluid, and no lymph node enlargement, nothing. So this is also possible with homeopathy. It can modify and never say that homeopathy can cure things. You could say the better term is we could modify or we could enhance. You always try to prefer these words. This may invoke less criticism. It can improve quality of life. Another case, so enhancement of survival rate in lung cancer is a single case study. 73-year-old male, NSCLC means non-small cell lung cancer. He was having the comorbidity, diabetes mellitus, hypertension, cardiac disease, dyslipidemia, right lower lobe mass with lymphatic spread. We put on homeopathic medicines. No other treatment was taken. 2019, 8 month, dyspnea of exertion, pain in right side. Kali carbonicum, we started 0/3, 0/6. In between, he had attacks of hypocalcemia, hyponatremia. All were corrected in our center only. We used to give 3% of NaCl or calcium gluconate in normal saline. Had attack of severe dyspnea and rattling. Medicine along with Kali carb 90 day also was given. Surviving more than 1 year and 4 months without any intervening infection. As I told you, whenever we say a statement like this, the patient had a survival rate of 1.5 years with no intervening infections. And the review PET scan showed residual lesion persisting, but no evidence of other lymph nodal mets. You see, a patient with stage 4 lung cancer even after 1 year, the PET CT says no other mets still. Enhancement of survival rate in stage 4 lung cancer. Again, there is a case. I am crossing my time. 7. Okay. Lesion with extensive skeletal and lymph nodal mets. 3:2.4 lesion left lower lobe. Again, non-small cell lung cancer with a history of coronary artery disease, chronic obstructive pulmonary disease. You see, chronic obstructive pulmonary disease behind with CLN in front. What a difficulty for the patient. Taking treatment from our center from 2018, December. Arsenicum added, we started again, Calicar respirated 03, 06, 012. The patient is surviving for more than 2 years. Review scan 2021, latest scan Jan 23rd series. No intervening infections, that's a clear thing. Compared to previous CT, there is increase in primary lesion with appearance, new skeletal lesion suggestive of progression of disease. Definitely the disease has progressed, but not in the same pace as of if our medicines were not used. From 2018 to 2021, 2 years, still the patient is alive with no IP admissions, no other medications. Again, a case of renal cell cancer. 55-year-old male with metastatic renal cell carcinoma for which he underwent post-nephrectomy, then with a lytic lesion in right scapula and left 7th rib. 2018 November, he reported to us. Actually, this was a case from Palakkad referred by Dr. Balamani, CMO of Palakkad District Hospital. She used to refer regularly. The patient was presented with the right scapula lytic lesions and the 7th rib, 2018 PET scan. We put on him medicines as Oromet. His history is beautiful. Those are rare cases which we prescribed single medicines, Oromet Vanam, because he knows homeopathy, so he was able to wait. That's the beauty. He was an engineer. So engineers are always fond of homeopathic principle. They know the medicine will act in a single dose. So Oromet Vanam was given after 7 months, Oromet 10, then Oromet 50. His renal function test was done with normal. You see the 2020 Jan review by PET scan. No definitive evidence of metabolically active disease anywhere in the whole body survey. All those body lesions disappeared. That is the beauty of Orometallicum. Interval resolution of lesion in right scapula. That's the methodology. You should learn this word. Interval resolution. Whenever we say that our medicine was able to make disappear a lesion, the better word is interval resolution, because it means when we made an assessment during that period, it made a resolution of the lesion. So the scapular lesion and the rib lesion was not there. No new lesion also was there and surviving for more than 2 years. So these are the things. Now it's only materia medica part, which I think it's a malignancy materia medica for a calcarea post. It's a chili remedy. For multiple myeloma, we can use metastatic bony lymphomas. You can use. This is my therapeutic writing. I am trying to make a book on this. So these are the scribbling data for this book, therapeutics. So these are the materia medica malignancy points only. Calcarea post for bone malignancy, glandular malignancies, debilitating illness, sepia for pelvic malignancies, left-sided compliance, female malignancies with anemia. Always remember, sepia has left-sided complaint ameliorated by lying on right side with nausea. You can detect a sepia patient, a multiparous lady, okay, with malignancy, okay, multiparous lady plus malignancy plus pelvic malignancy plus left-sided complaints and plus nausea if it is there, sepia is thermally. Always we think of EPICAC for nausea, but remember cupromet and sepia is having more nausea than EPICAC. That's the beauty of homeopathy. Nasopharyngeal malignancy and sepia has got a particular symptom, aggravation from milk, but like milk. Celicia, therapeutic materia medica for malignancy, wasting, relapses from cold relapse, bony malignancies, lymphomas, skin malignancies, melanoma, celicia with acne. For medorinum, hopeless recovery to restabilize after interventions, metastasis, relapse, left-sided ovarian malignancy, specific, just like xanthocyanum, just like naja, just like Syngam valerianum, left-sided. For right-sided ovarian malignancy, podophyllum, palladium, platina, Pisia ora. Those are the medicines. Middle lobe lung cancer, lycopodium. This is the portrait of O.V. Vijay sir, because lycopodium intellectually keen but physically weak. That is the idea, just to make a clarity. Calcarea carbonica, glandular malignancies, endocrine malignancies, lymphomas, lung malignancies, prostate and penile malignancies, post-contractures. Don't worry, this book will come. I expect in 2021. Anastomotic cancers, arsenicum iodide in cancer, ulcerative malignancies, pre-ulcerative lapis alba, after ulceration, arsenicum iodide, malignancy with emaciation, that is abrotanum, ammonium muriaticum, argenetricum, ecrastis, glandular ovarian tumors, CA lip, CA stomach, in malignancy with intervening pneumonias, arsenicum iodide is a medicine, lacuses, hematological malignancies, multiple myeloma, left-sided ovarian tumors, ITP, Tuja, as you know, sarcomas, bone malignancies, bladder metastasis, gut malignancies. Again, left-sided complaint, but lying on left side. That is the difference between sepia and tuja. Tuja and sepia are having left-sided complaint, but sepia will lie on right side, while tuja will lie on left side. So this is my center, Government Homeopathy Cancer Center, owned by Malappuram District Panchayat, which we are having 10 bedded hospital, 2 ICU beds, 4 observation triage beds. Now our payload is about to commission, maybe most probably by this week, by Honorable Minister K.K. Shailaji teacher. So after our payloads getting function, 22 beds will be there with 7 departments, full-time staff. Fortunate enough. Thanks to all. Thanks for watching. Now it's question time. Thank you.